Hi, and welcome to Healthy Living. I'm here today with Dr. Alexis Almeida. Good to see you.
Hello.
We were just talking before. You are not a brand new doctor, but you're a brand new doctor in this area, but you're from here.
Yes, I am. I graduated from Bluffton High in 2011.
Gosh, I can't believe it. Talk to us a little bit about the progression from 2011 until now, about medical school and what you're doing and what brought you back.
Yeah, so my family is here. I graduated again from Bluffton High in 2011, then went to USC, go Gamecocks. And then after that, I was as a medical assistant. I worked in undergrad.
Oh.
Yeah. So I stayed there in Columbia for a couple extra years while I was applying to medical school, and then went to medical school in St. George's University. Did my clinicals in Jersey and Hackensack Meridian, which is actually where I was born. So
nice.
I got to come very full circle, very family medicine of me.
Did
Yes.
you want to be a doc?
Yes, I did. I always wanted to be a doctor. My dad's a doctor, my grandfather's a doctor, my mom's a nurse.
I swear, I was just saying before, same with my family. It is a genetic thing. I think you either you're predisposed to just understanding some of that lingo.
Yeah, definitely.
And now you're here in primary care with Novant.
Yes.
Talk to us about, and I really mean this, we were talking, I've got kids, and they, for some reason, they're from a medical family, and yet they're reluctant to get primary care. Yeah. And talk to me about what primary care, why it's so important to have a primary care doc.
Well, we are the front lines, I like to say, too. We are the quarterback. We try to facilitate everything with the specialists that a lot of people do need to get plugged in with. And we also are the people that protect you from specialists over having too many specialists, you know? So that we know what to triage needs to go to another doctor, what we can handle ourselves. We should be the first person you're able to call up and say, I have a problem.
Okay, so walk me through that. You and I have decided we're going to work together.
Yes.
So I come in and basically you are my director of first impressions.
Yes.
You're going to kind of clinically do assessments on me.
Yes, I screen you when you're healthy. We get a baseline, make sure everything that you're supposed to be getting for your yearly, your physical, your annual wellness, make sure that that's all checked off and that we're getting the correct screenings for you.
And so let's say, again, my kids are in their 20s and 30s, I'm in my 70s, so really you're going to tailor your practice, what you're doing as my primary care doc, to me and my age.
Based on your age and your gender. There's other screenings that we do for different genders as well. And it's lifelong, so there is no time that you should not be having a primary care doctor. And we usually see each other yearly, more if needed. It depends on every person and every diagnosis that they may have.
Is it important to develop a relationship with your patient? Is that part of the beauty of primary care?
Yeah, because you want to be able to be that person that you can confide in, you know, and it's hard. There's small appointments. Sometimes people feel rushed in the actual appointment time, but we all want to help. We want to get to the bottom of your problem. It's just being able to tackle things slowly as a primary care is the benefit of primary care. It's not the only time you're gonna see me.
Okay.
So if we say, this is your problem today, but I have 8 more, if your one problem's really big, let's bring you back for the other ones, because our relationship is lifelong. So
it's a beautiful thing, and you can help guide me. Is a COVID shot appropriate? Is this appropriate?
Yes.
Do I need the shingles vaccination?
Yes.
And then if I do need to go to a specialist,
I tell you who they are, where to get you there, who I recommend, and if you come with your own recommendations, I can review them and make sure I agree and trust in that as well.
I think one of the most interesting things for me about primary care, having someone who's primary care, is I guess I really would view you as my personal gatekeeper.
Yes.
Is that kind of how it works?
Yes, I'd say so.
And then you set a baseline for me. Would I be doing blood work, et cetera, et cetera?
Yes. And there's a lot of different ways to do medicine now. Sometimes you have a person that comes to your home through your insurance. We talk with what's best for you and what's most financially savvy for you in this day and age, making sure we're doing the right things for you and your health and to optimize that care for you.
Has medicine changed or evolved even into 3 to 5? Because even though you've only been in practice 3 years, that doesn't mean you haven't been in school for oodles and oodles and oodles of years. Are you seeing a trend called are you seeing a trend to more preventative medicine?
Yes, well, I specialize in family medicine is a preventative type medicine that we try our best to do our screenings to prevent and to keep you healthy as best we can and to find things early and to work on them so they don't get far along in the disease line.
I've always wondered, I wanted to ask this, as a good patient, what can I do to help you? What can I do to help you help me help myself?
Well, I think living a healthy lifestyle is always
Okay.
the first line, and then talking to your doctor as to what that means, because that can be very vague, but it's very specific to each patient. And there's certain diets that we recommend for diabetics, that we recommend for people who have a cardiac history, and then for the general population. So just being open to, even though someone else has been treated with something else or does a different thing, that it may not fit you in particular.
So I'm going to come next week to see you.
Okay.
What would you like me to come armed with? What could help you really be the best provider for me?
I would say for you in particular, your old screenings,
okay.
knowing where you've been.
Okay. Yeah, okay, no, that's important.
Yeah, so
okay.
knowing if we need to know what you have had done and where we're at in your health journey.
Are most people good stewards of their body? Are we good historians?
I think it depends on how complex your history is.
Okay.
If there's not much to remember, it's a little bit easier for everyone.
Okay. But I was really curious about that, especially as we're beginning to develop a relationship. Am I going to be hesitant? Sure, I got a mammogram every year-ish.
Yeah, no, and that is my job to help find that with you.
Okay.
And to make sure you're up to date, or if you still need them, or you definitely still need them, but when it is, when's the next time for you, and what have you seen before in your past on your old mammograms? Like, we need to talk about that in detail.
And one of the things we're going to do now is we're going to take a quick break here on Healthy Living, and we're going to come back and we're going to talk to one of your associates and talk a little bit about what she does and about the collaborative nature of your practice. So I'm really excited. Then we're going to bring you back, just so you all stay with us, and really talk about the synergy that you have and how you complement each other in practice.
Awesome. Sounds
Stay
great.
with us. We'll be right back.